doctor, but I'm also a data junkie. That's probably a bad thing to say. I'm a data nerd. I like data. I like it a lot, and I like the power it has for populations, for any decision making process. So I actually really is to provide a telemedicine service, and that is via the app that I'll talk about in a minute. What yours will do, or what we're going to do together, actually, to improve the situation. So currently, we have the app we used to use that was built by volunteers, and that enables a clinical officer to write a clinical question into the app that is then sent to a volunteer doctor. The first one was in New York, the first one ever for the virtual doctors was in New York, funnily enough, but now they're all NHS volunteers. And they, in their free time, they will answer a question that takes them maybe 20 minutes. And so it's not an immediate response, but within 24 hours, a clinical officer will get a response to a question. And it's going to enable us to do things that we were never able to do before. It's going to enable us to answer questions faster, I hope. It's going to enable us to transfer data more in a better way. But also we're going to be able to analyze what we do. And that wasn't possible before. So before we had to export things into a CSV file, and it wasn't possible to analyze any of the data. Now we'll be able to see who's answered, how have they answered, has the question been answered well or not, are there open questions? And it's making us scalable too, because before we were supported only by volunteers, and now we're going to have a full-scale professional app to support clinical officers. So it's very exciting. I think we're very, very excited to see how that's going to be. Ultimate goal really is, on the one hand, to try and avoid referrals to hospitals, to ensure that patients get better care, and to really increase educational levels as well. So to support people to grow where they are. And because of what we do, they have access to specialists, which they wouldn't necessarily have in their own countries.
Welcome to the Igniting Change podcast. My name is Duncan Cook, founder of Three-Sided Cube, trusted technology partner for some world-changing organizations. We know the power that technology has to have a positive impact on people's lives. But on this podcast, myself and my co-hosts Puff and Sophie are out to meet the people behind the technology, hear their stories and understand what drives them, and hopefully inspire others to join the mission and do some good in the world.
Welcome to the podcast. Could you introduce yourself? Tell us a bit about you and your career and where you are now.
Yeah, absolutely. Thank you very, very much for having me. And and me and the extended virtual doctors who I'm representing today. So my name is Isabelle Widmer. I am a physician, among other things. So I studied medicine. And when I was studying medicine years ago, I remember telling my cousin, I want to go and work with populations that haven't got enough doctors. And he was a sort of a somewhat cynical already physician. And he said, oh, everybody wants to do that when they're studying. And that, I never ended up doing that, but that desire to help people and to export medical knowledge to populations that really need it stayed with me. So over the course of my career, I studied medicine, worked in research for many years in the US as well. Then I joined the pharmaceutical industry. And since 2013, I've been consulting. And in the course of my consulting work, I was mentoring this charity, the Virtual Doctors. And they'd come to Basel to take part in a competition really for startups or for health tech startups that need support. And this is run by Basel City. And so the organizers bring on board mentors to work with these people for a day to focus on the topics they have. And the topic that we were discussing at the time was, how can we expand the service? And so you're allowed to pick who you want to work with. And I thought, this is fantastic. I finally get to do something that I've always wanted to do, and to work with this charity for this day. And during that day, it's fabulous because you pull in all the attendees of this meeting. So it's pharma companies, lots of different people who will then work with you in a workshop setting on the problem. And at the end of that, James, who is now our CEO, said, would you think you might be interested in being on our board? And I said, would love that. That would be so fantastic. And I think about 2 years later, I joined their board. So that was fantastic for me, because it's something that I'm not using my practical medical expertise in that way, but I am bringing my other knowledge and in being. I'm a doctor, but I'm also a data junkie. That's probably a bad thing to say. I'm a data nerd. I like data. I like it a lot, and I like the power it has for populations, for just for any decision making process. So I've worked in pharma for years in the medical sphere, but also with systems. So I've built IT systems in pharma, and when we started talking about adapting our app as well, I was very, very enthusiastic about doing that, because at the end of the day, if you get the right information in, you can help people. And if you get the right information to people, you can make a huge difference. And depending on how you build systems, you can do that badly, which is done very frequently, sadly. That makes me very sad.
Yeah.
And I think it's harder to do than people think. Well, it's easier to do well than people think, but it takes effort. It's not just say I'm going to buy a bicycle and ride the bicycle, and people seem to think that you buy a system and it's going to run itself. And if people don't actually like systems or understand the benefit, then it's just a bicycle in a shed or a system on a computer. It doesn't run. So I find that I'm now sort of putting two of my big loves in some ways into activity. I like the systems, I like the data, and we're helping people to improve health, and we are sharing knowledge.
It's incredible. So, Virtual Doctors is an amazing organisation.
Yes.
Tell us a bit more about them and what they do.
It's a fantastic organisation. I think there's so much that is truly impressive about them, and I think I had the two reasons. One, I was asked to join the board, and the other is I talked to the founder, Hugh Jones. I think you may not have met Hugh. And Hugh has this wonderful video where he tells the story of the history of the organization. And I still watch that, and it still gives me goosebumps, because he tells the story of he started working in various countries in Africa, I think in 1988, as a safari guide. And I actually spoke to him yesterday. I said, tell me, what is it that made you want to found the charity? And he said, well, I was there from 1988 onwards, and always in rural areas in Zambia, Malawi, sometimes South Africa. And frequently I would see people dying. There's a lot of mortality, morbidity from illnesses that would be easily treatable, but there was no access to healthcare. And he said, it touched me deeply, because these were people I knew, or they were people I knew of. So I was part of that community, and it was hard to see that people are dying, even though the diseases are treatable. And so that was something he lived with for a while as he was there. And he was there he was there for a long time. And then he told me that, I think it was 19, I don't know, was it 89 or 99? I've forgotten, but it was 1 year. He said he witnessed two situations that sort of were the catalyst for him to found the charity. And the one story that's really stayed with me is he was driving through the bush, and he saw some blood on the tracks, in the dusty tracks, and he thought, we're close to a national park, so maybe an animal has, a cheetah or a lion has attacked an animal, and there's blood on the road. And so he says he followed this track for 2 or 3 kilometers, and he came upon a man cycling in the heat with his wife on the handlebars, and she was resting against him. And he said, and I saw that was where the blood was coming from. She was very pregnant, and she was bleeding. And the man told him, I tried to take her to the hospital that's local. We don't have a hospital. We have a clinical officer who's a healthcare professional, but he's not a physician. And my wife needed something more. And the next hospital was 100 kilometers away, so 60 miles. And he describes this as he said it was November, the rains were coming, it was very humid. So just imagining being on a bicycle on a dusty track with your pregnant wife driving to the hospital, it's very touching to think about that. I mean, how that man must have felt. And Hugh then tried to help. He put the woman, they said, we put her in the back of my pickup truck. That was the best I could do. The man came with me in the car, and we drove. And he said, as we drove, she quietly died in the back of my car.
Wow.
And he said, and that was the moment. He said, that was the moment where I knew I have to do something. And he said, but what can I do? I'm a safari guide. I'm not a doctor. I have no access. I'm not a millionaire. So I don't really have any power. But the idea didn't leave him. I think that to me is what speaks to me so much about this charity. It's sort of, it speaks to the effort of one human being who is in some ways, just Hugh Jones, nobody special, but
Yeah.
he cared enough to make a difference, and he cared enough to keep that idea in his mind. And he started talking to people in Zambia and said, look, to doctors. He had a lot of doctor friends, but they were all in the main cities. And so he said, they're too far away to make a difference. They were willing to help for free, but he said, okay, that wasn't going to work. And in 2001, then he'd finished his master's, and the idea was still with him. So he said, right, now I have some savings, and the Ministry of Health had given him the go ahead to start a pilot. And so he did. He started a pilot, and he said, we started the pilot in 2001 with a computer, desktop computer, and or a laptop, I don't know, but it was a computer, desk based, in one little clinic 60 kilometers south of Lusaka. And he said it was close enough to make it feasible. He really wanted to go back to the place where that woman had died to help that. But it was too far away and not manageable. So they ended up with VSAT with the computers and generator run power for the computers. But he said the problem was that there were power cuts 8 hours a day. So it ended up being really not a feasible working model. And she told me this funny story of how the satellite dish would be on the top of the clinic and the kids would go up and swing on it. So then it would kind of get, off track and then they couldn't use it. So he said it was kind of funny, but it wasn't actually viable.
Yeah.
But he said it was quite, so at that point, of course, at some point, felt the phones came in. And he told me also this story. He was sitting in one of these areas, and suddenly he goes, "Oh, I have reception. Oh, I have data." And so then he realized that this is now where we can make a difference. We're using classic internet, classic phones. Apparently, there'd just been a pillar put up, and so then that really then enabled the expansion. And I think what I love about the story that continues. So he said the clinical officer said, we want this help because we can't access easily clinicians locally, and so he was very clear that it wasn't him bringing help. It was a collaboration, and he brought in somebody else on the board, and that person happened to be working with a company where they had volunteers who built the first tech. So the initial tech he used was software from India, and he said that it was too clunky and it was hard to work, so that was a problem. So then he decided to build his own tech, and with the app, so that was the first app that was built, was volunteer built. And I think that to me that was also really nice because it's such a grassroots type of effort, right? There's some man in the bush, and then he has wonderful charisma, does Hugh. So he's very good at bringing people on board, and so he was able to grow something because of that strong belief he had. And then we had the app, and that was where we were up until not that very long ago.
I think it's fascinating how we glamorize founders that start businesses.
Mm-hmm.
We don't glamorize founders that start charities, and the effort that you need, determination that you need to do that is just exponentially more than it is to start, a startup or a business. You very rarely talk about these type of founders, but it's incredibly, it does blow my mind. I mean, I've started a business, but to start a charity from scratch with an idea, and maybe like you said with Hugh, he's not in that field. How does he start off? Where does he get funding from? How does he, get people to buy into the idea? And he's breaking new ground. In terms of, does it actually work? Does it, can we get the technology to work? I think it's incredible.
Well, that's why I wanted to tell you the story, because I was thinking about it the other day, and telemedicine is in everybody's mouth now. Everybody talks about telemedicine and telehealth and virtual doctors, and I don't know, it's nothing special. But I was talking to a 16-year-old last night about computer systems when I was younger and he wasn't existent, and he says, "Oh, 2001. Did you have data backups then?" And I said, "The internet did exist. You know that it's this." The world did not start when you were born. There were things before, right? There were mainframe computers in the 60s. I mean, there's been things from the 40s onwards. And of course, it's evolved and it's become smaller and more efficient and what have you. The computational abilities have become bigger. But it was just quite funny, I thought. But it did make me think that in 2001, I think I had my first email account in 1999, but it was very early on,
Yeah.
and so thinking of doing a telemedicine service with doctors abroad serving Africa, African countries back then was actually quite revolutionary. Nowadays, you think it's nothing special, but back then, for somebody who's neither a tech expert nor linked into that, nor a doctor, but just somebody who really cared, I found that quite inspiring. He didn't just say, "Well, I'd love to do this, but I can't." He said, "Right, something has to be done. There's just me, and I'm going to make something happen." And yeah, I do find that very inspiring.
Yeah, hugely. And we were all still on dial-up in 2001, right? That
Oh,
dial-up
I
was
remember
the only way.
little diddly diddly diddly. Yes,
Yeah. So
yeah,
communication was very slow, right?
yeah.
You'd be lucky if you get an image, you'd get some text backwards and forwards. Yeah, you'd get the lovely noise that we all
I actually
reminisce
quite
on.
like that noise. It was
I do as well.
nice. It's
It's a good throwback for
yes.
sure. So talk us through. I mean, they are. I talk about. We obviously work with a lot of really um, amazing organisations that are having huge impact. But um, I definitely have a soft spot for virtual doctors, just in terms of what you're doing and what you're trying to
Mm.
do. Can you talk us a bit about? So we're working on. We've kind of started working with you on the app to
Yep,
take it on to the next phase.
absolutely.
Can you talk us a bit around that and what your hopes are for
Mhm.
that when we get that out into the field?
Okay. So, I mean, if I can just a quick backtrack. So, what we actually do, because I haven't really talked about that. I've talked about what he
Yeah.
wanted to do. So what we do is we support clinical officers who work in rural Africa, and it's probably hard to imagine for somebody who hasn't been there. We've seen photographs. So this a clinical officer would be somebody with maybe 2 years of clinical experience. It's not a doctor. And that person is managing a whole population of individuals who are very far away from the nearest hospital. The nearest hospital is usually about 100 kilometers, 60 miles away. And there are sometimes ambulances, but usually a patient needs to pay to get themselves to a hospital or cycle. And I was talking to our CEO who reminded me that many of the patients, when they're female, don't want to go because they've got small children or they have crops. And so even if they are very sick, it costs a lot. They have to pay themselves, they have to pay in the hospital, they have to take their family members with them to look after them. And so people, even if they could, they generally try not to go because they have so much to do. So the goal of the charity really is to provide a telemedicine service, and that is via the app that I'll talk about in a minute. What yours will do, or what we're going to do together, actually, to improve the situation. So currently, we have the app we used to use that was built by volunteers, and that enables a clinical officer to write a clinical question into the app that is then sent to a volunteer doctor. The first one was in New York, the first one ever for the virtual doctors was in New York, funnily enough, but now they're all NHS volunteers. And they, in their free time, they will answer a question that takes them maybe 20 minutes. And so it's not an immediate response, but within 24 hours, a clinical officer will get a response to a question. And the ultimate goal really is, on the one hand, to try and avoid referrals to hospitals, to ensure that patients get better care, and to really increase educational levels as well. So to support people to grow where they are. And because of what we do, they have access to specialists, which they wouldn't necessarily have in their own countries. And I think it's also very important actually here to say that the clinical officers work rurally and they are tied into a district where there is a clinician, or there are clinicians in the hospitals that will be accessible for them, but those clinicians are also running the hospitals and doing a lot of the administerial stuff, so the managing. So there's not really enough resources for them to tie into, even if there is the knowledge locally. So that's why our service sort of supports that and buffers it. And I think it's something we forget frequently, that there's not enough doctors worldwide already. There's not enough healthcare
Yeah.
professionals, and so there's not enough in Africa either. So that's the background. And our challenge with our old app was that it wasn't scalable, it was clunky, and it wasn't fit for purpose. And so we've been looking for a long time on how to build something professional. And of course, with the volunteers, it's not possible. So we were very excited when we found you, and found you with your, I think, passion for the topic. That was something that came very strong, through very strongly. We spoke to Gabby right there. The excitement to do something that is going to help people. And so what our change now is with your app. It's going to enable us to do things that we were never able to do before. It's going to enable us to answer questions faster, I hope. It's going to enable us to transfer data more in a better way. But also we're going to be able to analyze what we do. And that wasn't possible before. So before we had to export things into a CSV file, and it wasn't possible to analyze any of the data. Now we'll be able to see who's answered, how have they answered, has the question been answered well or not, are there open questions, and it's making us scalable too, because before we were supported only by volunteers, and now we're going to have a full-scale professional app to support clinical officers. So it's very exciting. I think we're
Yeah.
very, very excited to see how that's going to be.
It's definitely super exciting, and it's great also, I think, when you're starting up a concept, to do it you want to prove that it works
Yeah,
first, right? Rather than going to that, big scale stuff. There's so much you need to prove. What works, where are the
yeah,
problems, like you were talking about, like the getting access to the data. It's good to build something and then find out, one, that it gets used and is working, and the fact that it's clunky or you can't get to the data is almost a good part of the process,
you're right.
because you're never gonna build, and especially obviously with volunteers, they have different times and all of that kind of stuff. You're never going to build something great straight away. It's really just about learning
Yeah.
all of the everything about it. So
Mm-hmm.
I think that's what's great for us, is that we come in with just so much of that knowledge, right, and so much of those of that being learned. I think it excites us. This is kind of why we get up in the morning.
Mm-hmm.
It's why the whole team gets up in the morning, just to be involved. I mean, really, you'd almost pay to be involved, right? If you could, into a project like this, but
Mm-hmm.
you would, right? I don't know anyone that wouldn't want to spend their time
Yeah.
on something like this, especially if we can have real impact, and really start moving the needle. It's just, it's a lot more fun, but I'm certainly keen. I think we're going to chat
Daniel.
post once it's out,
Yep.
and what's working, and we should have a really honest chat about that. What works, what's good, what's bad. I think it's really useful for people to know, because as you say, any project, any tech project, I mean, I've been involved in a lot of them,
Yep.
at different organizations, putting software in and stuff like that, and they are, a lot don't work, and a lot are painful.
Yep.
A lot do, but it does take a huge amount of effort. But mainly they don't all work perfectly. That's for sure.
Well, I think you make an excellent point I didn't think of. You're right. We have benefited by having something in place that wasn't perfect, right? And I think there's a couple of benefits. One, we had a system out, so it's been socialized. People already use a system. Often people that I work with, I do a lot of system rollouts, and people sort of go, but I like my old system. I don't want a new system, right? I know where the button was. And I totally relate to that, because when I'm using Windows and every 5 days there's an update and suddenly things move around, or
Yeah.
Excel moves stuff around all the time. And you think, but I just knew how to do it, and now I have to think again. It's really frustrating. But for us now, we've had a system that worked. I mean, it was fit for purpose ish, but it wasn't. having something now where one of the things I love about the system that we're going to have now with you is the fact that it's going to be, I always get customizable and configurable wrong. I know I shouldn't, but I do. So that we've got the back end where if we suddenly need to say we want to pick up infectious diseases that are, I don't know, another pandemic, for example, where we're hearing people putting it, we try and keep the system pretty simple. So what we're typing in is very basic, but then we could add a field easily to say, was this an infectious disease? And that will enable us to suddenly pick up signals in a customized way when we need it, rather than having too much in the system. So it's not too heavy, I think, right now. I mean, I haven't seen what it looks like at the moment, but it's fit for purpose and quite streamlined, so people will be able to fill it in the time that they can with 50 people waiting outside. And so it's reasonable, but it's also flexible enough to adapt to what we might need in the future. And I think to me, that's very exciting. And the other bit that's very exciting is, as you said, we've had years of experience, but now people on the ground have also had years of experience using the clunky ones. So now something, downloadable, functional, modern is coming along.
Yeah.
I think that's really very cool, because we're showing growth, but also we're giving them something better. I mean, a lot better.
Yeah.
And lastly, of course, if we do, the goal ultimately is to work with countries to make them independent of us. So at that point, you need to have something that you can say, here's an app. You're now free to work independently of us with help from us if you need it. But if it's volunteer driven, you can never actually get to that next stage where you can say, we've now built the system, implemented it, supported, trained, and now we want to not set you free, but give you the freedom to work how you'd like to independently, so that we can go and work with other countries. And that wasn't possible before, and now it will be. So I think that's really very exciting. And because I like data, I also like the fact that we can find out what we're doing, and we can identify where to improve. Because without data, you can't do that, right? You're doing a good service, and people can say, give me 5 stars for giving you good information. I mean, that's good, but now we can actually find out. Let's say if a clinical officer fills in information and then says, but I never got an answer, at least now we can find it. We can ask the volunteer doctors too, can you rate the case? Are you getting enough information? Are you getting the right information? And then we could at least pull out the cases where the information was not adapted and go back and talk about that. And I think that's something we couldn't do before. So it's going to accelerate the way we can provide learning and also collaborate across countries. And I mean, that's, again, 2001, Zambia, the UK, it was quite far away. If you remember how much phone calls cost back then. Everybody uses WhatsApp now, nothing costs anything. So nobody thinks about it, right? But back then, those were truly worlds away. And so the app is going to break down more barriers, and I think that's very, very, very exciting.
It's very interesting when you start looking at the data, just understanding like the questions, what doesn't get answered. It will open up, I think, a world of, as you scale, and that's probably an interesting one to talk about. You do need to understand that, right? You're going through an optimization process. How can you reach as many people as possible? And that is a process of like eliminating steps or optimizing steps. And the only way you can do that is through the data that you're gonna that you'll see. That's really interesting. So can you talk a little bit about where Virtual Doctors is going? You were talking about scaling into other countries. What are your plans?
Well, it's open, because currently we started out in Zambia in 2001 in one district. Now we're in the last, I think, year and a half. We're in every district, so in all 10, and we've started out with a pilot in Malawi as well. So the goal ultimately is to expand into other countries, but of course the question is, how do we make sure that what we're doing now really works where it is, and how do we get it to a point where it's embedded? And one of the goals that that I feel very passionate about as a doctor actually is that and that's one of our goals, is to make it more local, so that that ideally
Interesting.
the clinical officers can also reach out using the app to a regional clinician, and that the volunteers that we have maybe sort of slip into a second position, as an overflow or as a backup, because if we can't move there, then we can't really move out of the country. So that's one thing that we're looking into doing, but of course that's a question of resources, and also if a regional doctor already has many patients and managerial responsibilities, it's going to be hard to put them into the app as well. There is some thinking as well. One of our, of course, the app it has a 24-hour time lag naturally because it's volunteer staff, but we have been having conversations with somebody who runs a 24/7 phone line out of an African country. I don't want to be more specific at the moment. And I met her at a startup convention where there were African startups talking about different key issues in African countries. And she said, "You know what? My doctors might be willing to volunteer for your charity on the phone." I said, "Do you think?" She goes, "Yes, I think. I mean, we've got them on the phone anyway. They are answering calls. They're trained in English. They're in sub-Saharan Africa, so they understand the area very well. And I think so. We're going to have a conversation with her. I don't know where that will go, but I think it's just really important to be open to the opportunities,
Yeah.
and to see what else could slot in. So if something like that could slot in as well, then we'd have immediate response for cases that are emergencies that don't necessarily get to us in time, and that
Yeah.
would be an added layer. I can't speak for the charity, but I can speak for myself. So one thing that I would love to do as well is to potentially think of putting in sort of a buddy system, almost like somebody, maybe a regional physician, saying, I'm a pediatrician and I would love to be partnered with a pediatrician in, I don't know, anywhere in the world, so that I can discuss my cases. If that adds value. I know that, I worked for pharma for many years, and one thing that we used to do was the same thing. We would work with rising stars in one country, and you might, a young doctor, and you'd say, would you like to go and spend a month at the MD Anderson Center in the US, working with people who do this all the time? And so it's a knowledge exchange, and I think that's something that the world depends on, exporting knowledge, making sure people can share, and of course it's not one side teaches the other. You learn from each other, right?
Yeah.
There's things that we do, and I saw this really cool video at one of the startup conferences where a young African entrepreneur, I can't remember, I think it was Nigerian, was presenting, and he said, we have this app, this system where we have doctors upload operations they do. And so somebody put their hand up and said, but you're using African doctors to show African operations, and you could be using other channels, and there's a lot of official operation access. And he said, well, that's all very interesting, but they work in an area where they haven't got access to a lot of the stuff that you have. So if I show them something technically brilliant
Yeah.
from somewhere in the US, it's not going to work with us. And I think that was quite interesting. So that's another thing I'd quite like us to do. I don't know if we can do it in the app yet. We probably can't. To be able to share we can share photographs, I think, but it would be quite nice if you could do X-rays and maybe do diagnostic data. We've been talking to people about that as well, and so I think there's so many things that could be done, and there's a lot of potential partnerships as well. So
Yeah, I can imagine partnerships could be huge, right?
Yes.
Where's so you almost do have a supply, well, you do have a supply and demand, right? Your demands from the clinicians in the field,
Yeah.
and then your supply. How does that work, and where do you get bottlenecks, and does that change over time?
That's an interesting one. I think we have, I say we're blessed, but I think we are. We have 230 volunteer doctors in the UK who are willing to give their time, and there's actually some very lovely the team in Zambia has been doing sort of interview videos with the doctors, and it's actually really nice because you have these young clinicians who are specialized in something, and they're talking about why they volunteer for us, and that's a lovely video to watch. And we also have the clinical officers who have also been interviewed and asked what it is that they appreciate, or specific cases where they have learned. And so we have, at the moment, I think it's about 20 to 30 minutes a case answering it. And with the 230 volunteers, they have maybe maximum, not even probably two. I think the idea was 2 to 3 cases a week, but they don't get that many. So at the moment, we don't have that many bottlenecks. But of course, we've scaled up a lot. And so I think it will change. I think you've rolled out systems, I've rolled out systems, right? The harder it is to get something through, the more you think about, oh, my life is too short, I can't do this. But once you have I'm sure you've never felt that way, but when I'm filling in a document for British Airways and you sort of fill in anything, you could make this so much easier. So I think now with the app that you've built with us, let's see what happens. But I think then we'll probably see a sharp increase in cases because it's easy to use. It'll be in the Google store at some point. I think we're looking at doing that at least. So it'll be downloadable. We'll have access to it, and I'm anticipating we'll have an increase in cases then. But the ultimate goal, I think this is where it's hard, right? We measure our efficiency in, are we getting enough questions and are people using the service? So are we providing something that has value? And so in some ways you say, well, the more questions we get, that means we're doing a good job. But ultimately, and we can't measure this right now, but I think we should in the future. We should be looking at somebody using the app on his career path. So let's say if I start using the app, I might ask lots of questions because I don't know very much, but maybe I'm insecure. Maybe I've started my job in a new area. I want somebody to sort of confirm what I'm doing. I mean, when you're in a hospital as a physician, like I used to be, you could pop around the corner and ask somebody else.
Yeah.
These people cannot. So ideally what we'd see in the app is people asking more straightforward questions. And as they progress working with us and working, we also have a WhatsApp group for them. So they network amongst each other too, and they share cases. So as the learning progresses, we should see that they're asking more and more complex questions. And equally, we should see, I hope, in a region that the questions will increase, but at some point they should taper off, or at least just move to more complicated questions, because hopefully we're expanding their self-sufficiency, which would be the goal. And that's not meant to sound patronizing. I hope it doesn't sound patronizing. It's really meant to be supportive.
I think it's like you say, it's all of the kind of mechanisms that you would use, as a physician yourself.
Yeah.
But you have access to them and they're right there, right? And right available. So that's a really interesting data path to like analyze and understand.
Yeah.
I mean, you'll need a lot of data to understand that.
Well, it's hard to identify what it is you're looking for, right? I mean, to pick out
how do you categorize it?
Yeah.
It's really interesting though.
Yeah.
I mean, that you're right. That is really what you're looking to achieve. That would be fascinating to work out how you do that.
It's hard. I mean, it's hard to measure, but I think it's also. I mean, I've rolled out a lot of systems in pharma for medical documents, and it does. In pharma, we'll have this categorization of, is it sort of a frequently asked question, and can I answer it using the product label? So there's. And you might be able to do something sort of similar, but again, of course, it's so much in a different context. So they're far away from things. They may not have access to certain products. So it may be quite hard to do, but maybe it'll also be a qualitative sort of analysis. It might be, do you feel that you're asking more complex questions, or so that we're also measuring it from our side based on best ability from the data. And I think that's where I see the problem too, is you have to find some hook within the data so you can do it quantitatively, rather than having to read through questions and say, I think this one's a simple one, right? Because then it becomes very arbitrary on who's evaluating it.
Yeah, for sure.
So I don't know, bottleneck. We're expanding now, so we're looking for physicians. We only have UK physicians at the moment for various reasons, but we're looking to expand that as well. And there's one thing that I think is really really exciting that our medical director Daniel has suggested from what he's been seeing, that we bring in volunteers that are specialised nurses, so wound care nurses, because he says there are lots of things where he is a GP or me as an ex-GP. We're not that's not what we were trained on, but there are people who are really trained to support there, or people who are trained in maternal care, or physiotherapists. So there's a lot of activity now also to look at supporting orthopedic cases. And we were supported by J&J as well to work with them to support orthopedic cases as well. So there was a thinking from Daniel's side that we could bring in physiotherapists, because of course a lot of rehabilitation there's the medical care, but then if people don't learn how to walk and use that limb and are not supported, then the medical care can only do so much.
Yeah.
So I think that's the I don't know, the one thing is measuring the impact, the other thing is bringing in extra skill sets that can support, that we don't currently have in place, and that of course, I mean, even in a country like with a system like the UK or Switzerland, it's still not easy to get access to a physiotherapist that's specialised on whatever it is you have, right? Even in places where there are more healthcare professionals per individual in the population. So I think that's exciting too. It's and how we're going to probably have to adapt the app again to, adapt for maybe special questions. And one thing I also want to put in, you didn't ask me this, but something else I'd like to put in is to training documents.
Interesting.
So that let's say I have a question and it's, I don't know, I've got somebody with a bladder infection and I'm looking at what should I do? I mean, and it might be a complex case, I don't know, but you could type that in and have the app tell you initially, not like a chat GPT, but something like a decision tree type thing that says, in this situation, based on, you could even type in what antibiotics have you got available, what have you done so far, and it could sort of say, these are kind of the general things you might want to try in between getting an answer from the doctor in 24 hours. And if you're interested, here's a sort of a one page document so you can read up on differential diagnosis or whatever it is, so that they have access immediately to a quick doc where they can read additional information. Because sometimes you might have a minute, you might not have a minute, but sometimes you might go, I'm really curious or irritated about this and I want to know the answer now, and you might read up on it. And so I think, I don't know how feasible that is or reasonable they will use that, but I believe very much in offering people things and then they can take them or not, but at least you've offered them.
Yeah. There's so much opportunity there, right?
Yeah.
In terms of if you go back to the core idea of what you're trying to do, there's a big list of things that you could do, right, and could potentially have serious impact. It's pretty interesting. I do find it. I do often find as countries develop, they get to skip certain parts of like the technology landscape. If you like, they can almost jump a level because they can jump into. We've got a whole bunch of technology now that was never available, that now is.
Well, that's a really interesting one too. I'm currently taking a course on artificial intelligence, but non-coding artificial intelligence, and they started out with the history of computing and computers and data and analytics, and it was fascinating how he starts out saying, well, back then we used to save data on magnetic tapes, and sort of how that impacted what you were able to do, and then the impact of not having the computing power to be able to actually do anything with the data. And so, to your point, you can then, if you come in now, you can go, right, well, this is all available. There is the caveat, I'm going to sound very cynical and negative here, but I do have many conversations, and it's a bit like, I don't know, it's a bit like having the Wizard of Oz or Mary Poppins, right? I sometimes talk to people about data analytics and they say, can't we just put artificial intelligence on top of this? And I'm like, do you ever call Mary Poppins to clean up your 3-year-old's room? Does it work? I mean, I know I have that desire too. I don't have a 3-year-old, but I do
Yeah.
have that. Wouldn't it be wonderful if I could just call the universe and poof, this would all go away? It would be
Yeah.
fantastic. Um,
I think I mean, we're definitely we get the whole curve in terms of the hype curve
yeah,
with all new technology and AI can do a huge amount and undoubtedly will do a massive amount. But our expectations of what it can do versus what it can actually do in certain scenarios that gap um, is reasonably sizable. But there's no doubt it's going to be the underlying.
mm,
But data is going to be the key to that, right? That is, having the right data, access to the right data, so it can ingest it,
yeah.
understand it, understand the needs. That is definitely going to be the key. But I'm sure virtual doctors will be using AI at some point,
No,
right? There's no doubt about it.
well, absolutely. I think that the potential and the promise is huge, but I think it ends up being what you said before, right? It's you still have to think. You
Yeah,
have to think about, and this is the same thing for us with the data analytics. What am I capturing? Because you can capture everything, but we both know that that doesn't necessarily add any value. And you can also drown in data if you capture the wrong
yeah,
data points. So, and what do I need to combine? And what ultimately, actually, the first question I always start with is what do I need to show and why? And then I work backwards from based on what I want to show, what am I going to capture in what way, so that when I've captured it, I don't end up at the end going, I have captured it, but not in a way that I can actually analyze it easily. So I've got to do it manually, which is something that makes me really upset. So I think yes, it has a lot of promise, and of course, I mean, it's everywhere already, right? It has been
yeah,
for a long time. Only now we're talking about it because there are systems online that anybody can access, and years ago they were working in the background. I have a friend who worked on airplane engines, and he told me this wonderful story of the engineers who used to make sure the engines were okay for takeoff, and then they brought in algorithms to do that. And the engineer said, "Oh no, we don't. No, 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 no." And that's a normal human reaction, right? It's like, oh,
yeah,
it's a machine. I don't know. So they at one point, one of the engines was declared not fit for takeoff by the system, and the engineers looked at it and said, "Oh, I should be fine." And the engine failed just before the point of no return on the runway. And so he said that was the point where we had a conversation again and said, "Okay, look, there is millions of data points in an engine that
yeah,
need to be monitored, and a human brain just can't compete. Right? It's the volume of data is too much." And then they ran tests. They compared performance of engineers versus the system. And I think the engineers were sort of, I don't know, 2 or 3% point worse than the machine, which is not surprising. Not that bad actually, but still,
no, pretty good.
it's pretty good. I think it was sort of 98% to 96 or something, or maybe 90, but it wasn't, considering, pretty good. But
Yeah,
still, he said it took that failure, or it took that warning sign, if you will, to have people
yeah,
go, okay, maybe we need something else. And that, I mean, this is, I don't know, this is 20 years ago. This is like years and years ago. So it's only now become a topic because we can see it, feel it, and play with it now. So it's
yeah,
yeah, we're off topic,
yeah,
aren't we? I'm sorry, but it is
for
one
sure.
of
No, no, no. Well, it is. I'm not sure we are actually. I
okay.
think it's another tool that comes into the mix, and I think with all of these tools, it's around, does it add benefit, right? Will
Yeah,
it actually help you? Does it help them get the answers quicker? Does it help them get the right answers? Does it simplify um, the process? So I wouldn't be surprised if we're talking more and more. Well, we are going to be talking more and more about it, but
well,
I'll be interested with virtual doctors how that like evolves, and
yeah,
then like I'm gonna be interested to chat. Once we've got this app out into the world,
it's
and
going to be
just
exciting, isn't it?
it'll be super exciting. But
Yeah,
it'll be super exciting to talk around not only the good stuff and what it's improved, but
yeah.
also the challenges and what's been learned through the way. But yeah, been incredible to talk to you.
Thank you.
Really, really incredible. And like, um, obviously, people can check out Virtual Doctors website. Is there any way that they can help, or is there anything else that people can do if they hear the story and are interested?
Well, I think that one of the things probably helps most if they have a look at some of the YouTube videos, because we've got video that's I think that's where the story starts, where you think I'd like to be engaged. So you have a look at that. On the website there are a couple of calls to action. There's of course various ways. There's donations, but there's also the opportunity to help us with marketing activities if somebody's expert at that.
Interesting.
So there's a lot of different ways of getting involved: writing copy, working with the team, being a doctor, being a volunteer, being a physiotherapist, anything really. I think if it speaks to somebody who's listened to this,
Yeah.
then they can find a way to be involved if that's something that interests them.
Well, there's no doubt you're an incredible organization,
Yeah,
and just doing really interesting work, I think. And it's one of those that is I'm excited to see how what we've done together will get out into the field and how it will work, and just the data, like you say, being able to see that data is going to be super interesting. But just how it progresses, the opportunities um, seem to be more and more. You've got, you were talking about the partnerships
yeah.
and other services that can come. I think it's going to be fascinating, but amazing to talk to you.
Thank you very, very
Been a
much for
pleasure.
inviting me and us and taking the time to talk to me. I really, really enjoyed it. Thank you.
Great. Awesome.